And I will start by giving the background discussion of consent in psychedelic-assisted therapy, then present our objections to it, and finally present our positive proposal as to how we should go about addressing the question that we're going to bring up regarding informed consent. So in psychedelic-assisted therapy, we use substances like MDMA, LSD, ketamine, and psilocybin to address conditions like depression, post-traumatic stress, addiction, anxiety, and other conditions. And so far, there have been very promising results. Because of this, the regulation of the potential use has come up. And one of the questions that has increasingly getting attention is the question of informed consent. And much of this discussion has focused on the fact that psychedelic experiences can be transformative in the sense introduced by Laurie Paul. And a transformative experience is one which can transform you epistemically and personally. So something is epistemically transformative if you cannot know what it is like until you've undergone it. So you don't know what the psychedelic experience is like until you undergo the experience. And it's personally transformative in the sense that it can change your values, your priorities, and even your identity. And the problem that arises with this is that it's not quite clear for some people that if you go through this transformation, you can properly give informed consent. And the problem is usually posed in terms of rational decision making. So if informed consent requires understanding and evaluating future outcomes in light of one's values, if those values change unexpectedly, then perhaps the idea is that full informed consent is impossible. And we think that this is an important thing to think about. But the argument we're going to be putting forward is that if you focus on this, you overlook something much more important and much more immediate, which is that when you make a decision about giving your consent to a certain procedure when it comes to psychedelic assisted therapy, the decision is taken in an environment that is moralized and hyped. Now, sorry. Ugh. Okay. Yes, so in the West, the primary purpose of informed consent is, of course, to protect patients from harm, but it's also to protect clinicians from accusations of wrongdoing. And in order for informed consent to be valid, we usually require 4 conditions to be met. The first one is that consent must be informed. So a person giving consent must have adequate and relevant information in order to make a decision. The second criterion is that consent must be given voluntarily. So you should not be coerced or forced into giving consent. Then the person giving consent must also be capable of making a decision with the information given to them. So the person can appreciate, understand, and reason with this information. And lastly, consent must also always be specific, which means that you're giving your consent for a particular intervention and you don't give blanket consent for doctors to do whatever they want. So our claim is that if we assume that consent is possible for transformative experiences, even if we accept that it's no more problematic than in other areas of medicine, there is still a challenge to consent because in psychedelic therapy, decisions are not made in a neutral informational environment. And this is because patients encounter psychedelics as morally charged objects from the get-go. And this shapes both how deliberation takes place, but also affects how choices are made. And in order to capture this, we draw on the concept of moralization, which was introduced and developed by Paul Rosen and his colleagues. Now, moralization is a process by which preferences that once were seen as neutral acquire moral significance. So once moralized, a practice is no longer just an individual choice. It's not something which might be better or worse for someone. It becomes right or wrong. It becomes virtuous or deviant. And the typical example is smoking. Smoking was once just regarded as a personal habit, but it came to be viewed as a moral failing, which is tied to selfishness and disregard for public health. So quitting smoking is not just a prudent choice anymore, but it's a marker of moral responsibility. And in this sense, moralization is a recoding of social meaning. And we think that psychedelics are a paradigmatic case of moralization. And historically, they have been negatively moralized. So psychedelics was studied a lot in the context of psychedelic-assisted therapy in the 1950s. But then in the 1960s, because of different social forces, but also because of their association with the counterculture movement, the hippie movement, they became moralized. And they became symbols of rebellion, of hedonism, irresponsibility, and even social unrest. And we can arguably still see this moralization in the fact that they are still classified as Schedule I substances, even though there's a lot of evidence against the reasons given for that. Schedule I substances are substances that have a high potential for abuse and no medical value. But anyway, the negative moralization of psychedelics in the 60s led to stigma and framed psychedelics as the use of psychedelics as deviant or immoral. They were not neutral anymore. At the same time, though, and this is interesting, in certain therapeutic and spiritual contexts, psychedelics are positively moralized. They are seen as sacred medicine, they are seen as symbols of liberation, of spirituality, of authenticity, and even increasingly as symbols of moral progress. And the point of all this is that when patients encounter psychedelics, they don't encounter them as neutral medical tools. They encounter them as objects saturated with moral meaning. And we can see this in a discussion in a case mentioned by Faden and Beauchamp when they discuss deception in research. So they write, in a study comparing effects of LSD with placebo, the subjects were not told that LSD was involved, but rather were told the full chemical name, which would not be recognized by most of the subjects. And the known suspected effects of LSD were described to subjects in detail. It was felt that using the technical name and describing possible harmful events was adequate information, and that actually using the term LSD would have caused many subjects to refuse to participate on emotional grounds, while they might be willing if they were specifically told about suspected harmful effects. Since the technical name was the correct one and the suspected effects correctly described, the research was probably covered legally, but ethically, I'm not so sure. So Faden and Beauchamp here describe the situation when subjects were given all the relevant information about the drug, but were not told it was LSD. And when this happened, they raised no objections. But the worry was that once the term LSD was introduced, because of the strong associations with moral judgments and the beliefs that are associated with the term LSD, that would trigger an emotional response, and that would influence whether people were willing to consent. Now, moralization is one aspect of what goes on with psychedelics. The other is hype, because psychedelics are also subject to hype. And Interman has defined hype as the implicit or explicit exaggeration of the benefits of a treatment or the strength of supporting evidence. And we see this today in media narratives where you can see all around the internet, for instance, that psychedelics are miracle cures, that they resolve decades of depression in a single session, they cure addiction outright, they can even extend your lifespan if you take them. And though there might be a certain, kernel of truth in some of these stories, they never convey the complexity of the clinical evidence. And we can also talk of a sort of negative hype, the opposite, if you will. When in the 1960s, the hype was not so much how great the psychedelics was, but they exaggerated the danger of psychedelics during the so-called moral panics. And there it was said that LSD could cause genetic damage, they could cause permanent psychosis, it could make you think you're Superman, and so on. The problem with hype is that it uh, operates epistemically by influencing people's expectations. And hype and moralization work together and reinforce each other. So, for example, when psychedelics are portrayed as sacred medicines that can heal individuals and that can heal society, the framing is at the same time moralized in the sense that this is the right path for you to take, but it's also hyped that this will transform you, this will change everything. And the reason why this matters for consent is that, yeah, moralization and hype undermine the conditions for genuine informed consent because they distort the informational and evaluative environment in which choices are made. So they distort the risk-benefit understanding that is required for you to give authentic, informed consent. And this can be done in a number of different reasons. Different ways, sorry. So one such way is that moralization can reframe therapies from options into felt duties. So if psychedelics are framed as inherently healing or mind-opening, patients may feel obliged to undergo treatment and see refusing to undergo treatment as cowardice or close-mindedness or even lack of virtue. And this kind of framing calls into question whether choices are truly voluntary. And it also erodes the neutrality necessary for authentic choice. Because patients are not choosing a medical procedure anymore, but they are aligning with the normative expectation. And this weakens the integrity of the consent process. And it's important to note also that clinicians and therapists can also be caught in moralized framings. And this also undermines the neutrality that we require for informed consent. Moralization and hype can also shape disclosure. Positive moralization and hype can inflate the expectations of patients. So people may underestimate risks and overestimate the benefits. And this, in this sense, consent is not driven by informed risk assessment anymore, but more by promise. And on the other side, negative moralization and hype amplifies stigma and fear and uh, the dangers of psychedelics. And this again alters risk perception. So both moralization and hype distort the balanced risk-benefit communication that we think valid consent depends on. Now, when it comes to contested treatment, choices can also symbolize group identity or loyalty. So consenting to psychedelic-assisted therapy may be seen as a statement, a moral statement, a cultural statement. So the meaning of consent becomes identity signaling. And I'll return to this in a second. And lastly, there's also a worry that once psychedelic assisted therapy becomes normalized, it may be promoted as a tool for self-improvement. And this can create subtle social pressure to pursue the treatment, even when there's no need for it. And this raises autonomy concerns at the societal scale. So we identify three mechanisms of distortion. Yes. The first one is what I just mentioned, which we call symbolic reframing. So when consent becomes identity signaling. So in a moralized context, consenting to psychedelic therapy can become a symbolic act. It's a way of expressing who you are. And endorsing treatment becomes a statement of allegiance to a worldview, a political worldview, or a cultural or a moral worldview. And this is not a medical choice anymore. It's a declaration. And the problem with declarations is that they are very difficult to retract. Or at any rate, they are harder to retract than just giving consent to something. And this raises a psychological and social cost of refusal or withdrawal, and that undermines the idea of consent as a revisable medical condition. So in both directions, negative or positive moralization, the symbolic encoding undermines neutrality and the specificity that is required for informed consent. The second mechanism is affective contamination. So, as we saw with the example we gave above with Faden and Beauchamp, moralization triggers emotional reactions. These can be positive, they can be reactions like admiration or awe, or they can be negative, so they can be reactions of disgust or fear. And these shape how patients perceive and judge psychedelic therapy, and not necessarily consciously. And this has to do with the words in informed consent documents or the words that clinicians use when discussing psychedelic-assisted therapy with patients. So when you use words like plant medicine or entheogen or ritual, this can make psychedelics seem pure, natural, or sacred or redemptive. And this can lead patients to underestimate risks, overlook uncertainties, and generally have inflated expectations about the treatment. Negative moralization can cause disgust, it can cause fear, it can cause shame. And these reactions are associated with terms like hallucinogen or trip or LSD or even psychedelic itself, because these are associated with stigma, with crime, maybe with a war on drugs, and so on. So the point here is that affectively charged terms can distort the perception of both risk and the efficacy of psychedelics, and this undermines the goal of well-calibrated, evidence-based decision-making, which again, we think is necessary for informed consent. And the last mechanism is normative narrowing. Because what moralization does is narrow the perceived space of choice. So it's not really coercion. Nobody's holding a gun to your temple. Nobody's forcing you to consent. But it works more subtly. It eliminates viable alternatives from your point of view. It's what William James would say, certain alternatives are not live options anymore. They become invisible or they become unacceptable because they're morally coded as wrong. And Faden and Beauchamp distinguish between autonomous authorization and effective consent. So autonomous authorization is autonomous authorization is the moral idea of consent. It's when a person intentionally, with understanding and without controlling influences, authorizes an action. And you can do that even if you never form any consent document. Effective consent, on the other hand, is consent that counts legally or institutionally. There you do have to sign a form. So our point is that even if consent is legally valid, if it's effective, that is, it may not be ethically robust if the normative landscape is distorted. And together, moralization and hype actually undermine the autonomy and the neutrality that is required for informed consent. And we think that this dynamic must be made explicit if consent is to remain meaningful. And it's important to note that these mechanisms are not abstract. We searched quite a few consent documents and we found evidence of this in them. So we found clinical trial forms that emphasize Schedule I status, illegality, or they list rare but dramatic risks without putting them in context. And in this way, they import moral frames into choice. And we also saw the opposite happen. We saw integration forms where they frame participation in psychedelic-assisted therapy as a sign of growth, of healing, of insight. And in this way, implicitly, and actually some also explicitly, shape refusal as failure to evolve. So in both cases, consent is already moralized before you even start the therapy. Now, sorry. So this is all to say that patients are not choosing from a neutral menu of medical options when they start psychedelic assisted therapy or when they are asked to give consent to it. And we think this is a structural problem. It's not a matter of individual misunderstanding or insufficient disclosure by by an individual clinician. And for this reason, we think that what is needed is a moralization-aware approach to informed consent. And the goal is not to eliminate values. We don't think this is possible, but we also don't think it's desirable. The goal is to prevent moral meanings from covertly steering patient agency. And so for this reason, we think that we need to make value-laden framings visible, because that's the only way that they will become discussable and ultimately revisable. And we think that a few things are needed for this. So the first thing that is needed is linguistic awareness. Clinicians and researchers need to adopt consistent and value-neutral terminology when describing psychedelics. Because when you use terms like plant medicine or entheogen, which means God within, you implicitly valorize psychedelic use. While on the other side, when you use words like hallucinogen or trip, or you repeatedly reference Schedule 1 status or the fact that they are illegal, you reinforce stigma. So what we should try to do is to use descriptive and clinically accurate language that doesn't deny the possibility of spiritual significance, but doesn't endorse it either. So that we should avoid that moralized metaphors are built into consent documents. We also need expectation to calibrate expectations. So clinicians should explicitly present psychedelic therapy as one outcome of many. Because the truth is that psychedelic therapy can help. It can lead to improvement. It can lead to no change. It can lead to improvement for some time, and then patients relapse. And sometimes, and this is not always stated, it can be a very difficult experience. So we think that clinicians should present the whole range of possible outcomes and do so realistically, because this helps normalize the choice and counter the notion that psychedelics are uniquely beneficial or that they are uniquely perilous. And the last thing, which is extremely important, is that we need to protect the space. So consent discussion should allow space for patients to ask any question they want. And it should also make clear that choosing or refusing psychedelic therapy is not a sign of virtue or courage, or is the practice in psychedelic therapy. And along with these, we have some practical recommendations. Could be that we should have training programs that should help clinicians recognize and reflect on their own implicit moral framings. And there should be some empirical research into how moral language shapes consent documents. So this can be done by structured feedback tools or qualitative assessments that monitors how patients actually experience the consent process themselves. So we could assess whether participants feel morally pressured or judged in the decision. So taken together, all of these measures constitute a moralization-aware model of consent. And it's important to emphasize that the aim here is not to sanitize psychedelic therapy of meaning, but it's to ensure that moral significance does not masquerade as medical fact. It should be open. And if informed consent is to function as an ethical safeguard for psychedelic therapy, it must address moralization and hype directly and not treat it as a background noise. Very quickly, that was the outline of our paper. Thank you.